Hello everyone. Today's topic for discussion is principle of interpretation of a dental radiograph. What are the various principles in interpreting a dental radiograph? Dentists as we are expected to have basic skills in interpreting the radiological images that we make in our day-to-day dental practice. The various requirements and proper radiological investigations should include adequate diagnostic image. What is meant by an adequate diagnostic image? An essential first step is making sure that there are an adequate number of images of diagnostic quality that display the region of interest in detail. The radiographs what we take should give the proper information on the normal variation as well as the abnormal pathological variations in that area of interest what we take for a radiograph. When plane or projection images are used, multiple images at slightly different projection angles as well as images made at right angles to one another can provide in addition to the normal radiograph what we take. So when we take a radiograph, we can take some additional radiographs in right angles to each other so that it can give a three-dimensional representation of that area of interest. Next one is visual search strategy. What is meant by visual search strategy? The ability to recognize an abnormal pattern requires both an appreciation and an in-depth knowledge of the variations of normal anatomy of that particular area. We should be able to entirely see the radiograph. We should note the changes in the entire radiograph. We should not concentrate only in that area of interest where we are going to see the pathology. We should see the entire area of the radiograph in detail in coming to a radiological diagnosis. So the main strategy of interpreting a normal radiograph, dental radiograph, is to assess the presence, number and relative size, shape and direction of the teeth and the roots, and identify dental tissues, anatomic areas of interest and surrounding structures. This should be the main strategy. All findings should be interpreted with consideration of the age, size and gender of that particular patient. Let us see how we can interpret each dental radiograph in detail. In a periapical radiograph or an intraoral periapical radiograph, we should first start with the crown structure. We have to see the enamel pattern and the dentin pattern, any fractures or any radiolucencies that shows dental caries in the enamel or the dentin, or any fractures of the enamel or the dentin, and we have to move to the crown structure, that is the pulp horns, and any changes or alterations in the pulp chambers. Then we have to see the cemento-enamel junction and the alveolar bone crest, any alterations in the alveolar bone crest or the cemento-enamel junction we have to note down. Then we can see the periodontal ligament space and the root canals as well as the dentin surrounding the root canals and the lamina dura surrounding the periodontal ligament space. Any alterations or any break in the lamina dura can tell about any pathology involving the alveolar bone or the tooth structure. Then we can see the furcation area of any changes in the alveolar bone, and come to the periapical region, we can see any lesions in the periapical region of the tooth. Then we can see about the bone pattern also, any changes in the trabecular bone or any radiolucencies or any lesions in the periapical region and so on. Now let us see how to interpret a normal orthopantomogram or a OPG. Interpreting a OPG should be a systematic one. We have to first see the osseous structures and surrounding soft tissues. First we should consider the osseous structures and surrounding soft tissues. We have to see the bony structure first. Second one is alveolar process. Third one is the teeth and the related structures. First should be the osseous structures, that is the bony things. Then we have to see about the alveolar process. Then come to the teeth and the surrounding structures. Osseous structures, first in a general OPG we have to compare the left and the right sides. Any changes or any alterations of the size of the left side, any alteration of the side of the right side, we have to note down. Then we have to always see the periphery and corners of the X-rays. We have to see about the any alterations in the bone pattern of the cervical spine or the tympanic plate of the temporal bone, and the any alterations in the surrounding base of skull region. Then we have to see about the styloid process, any alterations in the styloid process, any elongation of styloid process, and pharyngeal shadows can also be noted here. And we can see the submandibular and the sublingual salivary glands, any alterations or any calcifications or any calculi in the submandibular or the sublingual glands or the ducts. Then we can see the alterations in the any pattern alterations in the hyoid bone or the surrounding structures. In starting the systematic study of a normal OPG, we should start from the right mandibular ramus. Then we have to move towards the right coronoid process, and we have to see any alterations in the condyle. Then come to the posterior border of the ramus and the angle of the right mandible, and slowly we have to move to the lower border of mandible on the right side and to the symphysis region. Then we have to move to the left side lower border of mandible, left angle of mandible, left condyle and left coronoid process, and we can see the right left ramus, anterior surface of the left ramus. Then in maxilla, we have to start from the posterior aspect of the superior surface of the maxillary sinus. Then we have to see for the any alteration in the maxillary tuberosity region, floor of the sinus, roof of the sinus, and the medial wall of the maxillary sinus of the right side. Then we can see any alterations in the nasal bone and surrounding structures. The same thing we can clip it on the left side of the maxillary bone. Then we can see the zygomatic process of maxilla and the any alterations or fractures of the zygomatic arch. Then we can move on to the orbit, left and the right side, any alterations or any pathological fractures or any pathologies in the orbital rim, floor of the orbit and the superior surface. We won't be able to see, only the posterior surface and the floor of the orbit we can see. So this is the way of seeing the osseous structures. Then we have to move on to the alveolar process of the mandible. Any alterations or any alterations in the trabecular pattern or the cortical or the cancellous bone pattern of the mandible should be appreciated. Then we have to come to the teeth structures. Any alterations in the fractures or any dental caries or any alterations in the tooth structures we should see. We can see for impacted teeth or any tooth buds, developing tooth buds and the follicular space and so on. So this is the way of coming to the normal study of a normal orthopantomogram. In coming to a radiograph interpretation of either a intraoral periapical radiograph or a orthopantomogram, we have to follow 5 essential steps in coming to a proper radiological diagnosis and to easily differentiate between a normal variation and a pathological variation. First one is localization. We have to see the lesion or the area of interest, whether it is localized or generalized. Then position in the jaws. We have to see for where it is located. Then single or multiple, whether the particular area of interest, whether it is in the single area or the multiple areas. Then observation. We should look for abnormal bone shadows, or you can see in this radiograph, you can see a cervical spine shadow in the symphysis region. We should be able to differentiate this from a abnormal pathology. This is a normal variation. And you should look for cervical burnout in particular areas. You can see from this radiograph in the left mandibular first molar distal aspect, you can see a radiolucency near the alveolar crest region. That is a cervical burnout. It is a normal variation of because of radiological burnout on that particular area, because there the enamel gets thinned out and it shows like a radiolucent lesion there. So it's a cervical burnout. it is a normal variation of a radiograph. Then any restorations or any foreign objects, we should be able to differentiate, observe. Third one is general consideration. You should know always radiograph is it's a two-dimensional representation of three-dimensional object. You should be able to study the various aspects of a radiograph from this point of view, because sometimes the shadows can be felt from the right side to the left side. For example, the pharyngeal shadow can be or the tongue shadow can superimpose on the mandibular ramus or the mandibular body. So you should be able to differentiate that from a pathological shadow or a pathological lesion. Then interpretation. Carefully we should interpret it, the normal variation from the abnormal pathology. This is very, very important. Then last is correlation. We have to correlate the above findings and come to a radiological diagnosis. So these are the various aspects of coming to a radiographic interpretation of a radiograph, dental radiograph. We saw in detail about the intraoral periapical radiograph or the orthopantomogram. Thank you.